Hello, everyone.
Hi, Della. Hi, Leah.
Hi, Lizzie.
Hi.
Thanks for being here.
Hi, Andrew.
Hi, Daddy. Hi, dear.
Hi, Andrew. Thanks for being here.
Oh, yeah.
Awesome. We'll maybe give it another minute or so and see if we have some other people joining us. But thank you all for being here. This is great.
Oh, hi, Andrew.
Oh, hi, Gabby.
How are you? Good.
Like old home week.
Yeah.
Hi, Norma.
Hi, how are you?
Doing well. My name is Lizzie.
Hi, nice to meet you via Zoom.
What?
Via Zoom, nice to meet you.
Yes, nice to meet you too.
Oh, Andrew, good background.
Mm-hmm.
Yeah.
I love it, Andrew.
Nice.
All right, well, shall we get started?
Yeah.
Yes.
All right, I'm going to mute everyone who's not our panelists. But of course, if you have questions, feel free and put them in the chat and we'll have lots of time to ask other questions as well. And I'm going to record. So if you don't want your video to be shown, you can go ahead and turn that off now. Alrighty. Well, thank you everyone for joining us on this cold Monday evening where a lot of us are in Seattle and it's pretty chilly over here. This is our third Family Health Forum. Today we have guests from New Generation Strategies who will be telling us all about the Dual Special Needs Plan. And here's our quick little agenda for today. We'll do our opening and housekeeping, what we're doing right now. We'll do some quick introductions. We'll let our guests take it over. We'll do some questions and discussions just throughout the panel presentation. We'll follow up with some resources and wrap up after that. So I am so excited and pleased to introduce you to Pat Raleigh, Norma McKinney, and Kathy Murahashi. Hopefully I pronounced that correctly. Awesome. And I'm going to let each of them introduce themselves. So go ahead and take it away.
Go ahead, Norma.
Well, hello and good evening. So Pat and I live in the greater Seattle area, and we are brokers who work with the special needs community to help them, educate them on the dual special needs plan. And we've been working around the state to educate folks to make sure they understand all the different things that's available to them in the area. And so tonight we'll be talking about that. And we brought a special friend with us, Kathy. And Andrew, I think you know Kathy. We met Kathy when she was at the ARC of King County. And so when she's moved over to her new role, we continued to stay in touch with Kathy, and we asked her to join because her son and daughter are actually on the dual special needs plan. So she can give us a lot of information what it's like to be from a parent and just ask additional more questions. So Kathy, I'm going to turn over to you. And if you want to say a few more words about yourself and kind of what you've been doing as well, that'd be great.
Yes. So I'm Kathy Murahashi, and I work at Community Homes, which provides housing for individuals with intellectual disabilities. But I always say my first hat is mom, and I have two young adults who live at home with me, and one has a developmental disability and the other one has a different brain injury. And as they said, my two kids are on this plan.
Thanks, Kathy. Back to you, Della and Leah.
All right, we've got a quick poll.
Awesome. So I'm going to launch this poll here. It's very quick, but it'll just give us kind of a just an initial understanding of where everybody is. So hopefully you can all see that.
All right, looks like we all voted.
Okay, and so I'll share this so everyone can just kind of see. This will give us an idea of our participants.
Okay.
Thank you for taking the poll, everyone.
Yes.
Great.
All righty, so I'm going to stop sharing and pass it on over to Pat and Norma.
So I'm going to turn it over to Pat, and he's going to walk you through some information on the dual plan. And if you have any questions, please feel free to ask. This is hopefully a conversation, not a lecture. And we would love for you to know as much as you want to know and ask as many questions. So with that, Pat, it's all yours.
All right. Well, nice to be with you this evening. And there's three important things on this first page. Those two cards at the top of the right-hand corner of the screen, the Medicare card and the Medicaid card. And we're going to be talking a lot about those throughout this presentation. And then the other thing that's important to us and that we've gotten to know Special Olympics, we certainly miss seeing you guys at the state swim meet this year. That was a lot of fun. We were there last year and got to meet a lot of people. And we certainly look forward to the days when we can get back to normal and everybody can get back in the pool and back on the baseball fields and at the golf course. So hold on.
Hold on. Having a little, it's little cantankerous. Come on. So, well, let us stop sharing. We're going to reshare. Give us a moment. There.
The slides wouldn't automatically forward.
No worries, that there is always something that comes up.
Let's try this again.
Hmm.
Well,
Would you like me to share the?
oh, there they were.
Oh, there we
There
go.
we go. There they went. They just had, you know what? They've had a hard day, and they were just being a little cantankerous. Okay.
So they didn't like me apparently. So we're gonna talk about the dual special needs plan, what we call DSNP. We're gonna do an overview, eligibility, how you are eligible for the plan, and then go through the program and show you what's in the program and how it works. Then we'll have time for question and answers afterwards. Here's Norma and I. We live in the Renton area, greater Seattle area. We have a daughter who is a sophomore at Washington State University this year. And I'm originally from Tacoma. Norma's originally from Texas. So I've been an insurance broker for over 20 years, I suppose. And look forward to dealing with people and helping them with their insurance needs on a daily basis. And we are your Medicare coach, the Medicare coach. We specialize in Medicare insurance products. This program we're going to talk about, dual special needs, is a type of a Medicare Advantage plan. So that's how we came to know about the plan, was through our Medicare insurance business. We are private brokers. We represent a number of different companies. But most importantly, we represent our clients and what they need for their Medicare insurance. This program is designed specifically for people enrolled in both Medicare and Medicaid. We get Medicaid when we have a limited income. And then Medicare is available to those that have a qualifying disability or irreversible medical condition. You need to have both of those cards to be eligible for this program. Okay, the dual special needs plan. We're going to go through an overview here of the plan. So the program, here's some statistics on dual special needs and on the special needs community in the country. There's over 12 million people that are eligible for this program. That means that they have the two cards. They have the red, white, and blue Medicare card, and they also have the green Provider One card that you get with Medicaid eligibility. There's about 2 million people on this plan around the country, so it's not widely known, but when you see the benefits, you'll understand why more people should be on it. In the state of Washington, there's about 28% of eligible individuals are enrolled on the plan. So Washington is quite a bit ahead of many other states. And the biggest reason is that more people are not on the plan. There's just limited knowledge of the plan. They advertise it a little bit, not a lot, but the big push is on other insurance plans. Okay, so the dual special needs plan is a type of Medicare Advantage plan. Medicare Advantage is an insurance plan that was created in 1997, and it was actually created as a temporary insurance plan. But the good news is in 2018, Congress passed and President Trump signed legislation to make it permanent. So this plan is now going to be around. It's not going away. And I think we're going to see more and more people being enrolled and taking advantage of the plan over time. And then one other piece of legislation that's important here, the Medicare Modernization Act of 1997, it defined who could be on this plan. Then there's three types of individuals that can be on this plan. Those that we call dual eligibles, they have Medicare and Medicaid. Individuals with severe or chronic conditions that are lifelong, and then those that have a variety of different conditions that require to be in a nursing home or some type of institution. And here again, here are the three types of a special needs plan: the chronic special needs, the dual special needs, and the institutional special needs. Now, thing to keep and remember about this plan: if you choose to go on this insurance plan, it does not cancel your Medicare and Medicaid. Quite the opposite is true. You have to have Medicare and Medicaid to be eligible for this plan. So it does not cancel anything that of those two required cards. Important things to know about this plan. The best part about this plan, there are no costs. Very little costs, and I'll explain that. There's no monthly premium. There are no copays. There is no Medicare Part B monthly premium, no deductibles. There is a small copay on prescription drugs, up to $8.95 maximum on a prescription, but even now, we're starting to see one of the companies this year came out and said there are no copays on prescription drugs, period. Here are some of the great benefits: up to $3,000 a year in dental, and that can be anywhere from an exam or a cleaning all the way up to dentures. The only thing it won't cover is cosmetic surgery, but it will cover everything: fillings, root canals, crowns, bridges, dentures. It covers it is a lot of money, and we hope people take advantage of it. But $3,000 a year in dental coverage. 48 one-way transportations. Some of one company, it's an unlimited amount of transportations. You can call them up and they will arrange transportation for you to and from your doctor's appointments. No cost to you. They'll come right to your door. They'll pick you up. They'll take you right to your doctor's place of business, pick you up there, and then take you home. Great benefit because it takes the pressure off of caregivers and so forth, and you're not relying on other modes of transportation to see your doctors. $1,600 in hearing aids, that's per year. So you get hearing aid coverage. You'll get the exam, the hearing exam for at zero cost, and then up to $1,600 of hearing aids. $1,200 of personal items in a catalog. These are personal care items: toothbrush, toothpaste, deodorant, shampoo. There's vitamins, over-the-counter cold medications, bandages, there's all kinds of items in these catalogs. One company utilizes Walgreens, so you can actually go shop at Walgreens. You get $300 a quarter of credit, so you can go in, and it's on a debit card. So you can go in, take your debit card, and you can shop, and they just deduct it right off of your debit card. Or you can order through the catalog, and they will mail it to you, and they pay the shipping. So you're not, you don't have to pay for delivery to your home. And here again is more about the personal items catalog. It's a great benefit, and we really urge people to take advantage of it. Doesn't cost you anything, and it's part of the plan. How does the dual special needs program work? It really is a complement between Medicare and Medicaid. It coordinates the monies that Medicare and that the federal government puts up to fund Medicaid, which is administered by the states. But it really is the bridge that ties Medicare and Medicaid together. The good news is all of that happens in the back office, so you don't have to worry about it. You just take your card, go to your doctor, get your coverage, and then get your services, and then they take care of the payments behind the scene. So let's talk about, here are some stories from some of our clients that are on the plan. And we've chosen two here, that one, an individual on the plan, and the other one from a caregiver. The individual needed hearing aids, dentures and adjustments, and new glasses, needed rides to the doctor, and could use help with her personal items. And she received all of those from this insurance plan. She was able to hear better. This lady actually had dentures, but they didn't fit. So she was able to get them relined and adjusted. And now she can eat a normal diet. She hadn't had new glasses in years. So she was able to get an exam and glasses, new pair of glasses. And this was really liberating for her. She didn't have to pay for a taxi or something, or an Uber to get to a doctor's appointment or take the bus. She now has a way to get to and from her doctor's appointments. She doesn't have to worry about it. It's a reliable service, picks her up, takes her there, picks her up at the doctor's office, takes her home. And it just reduced a lot of stress out of her life and her personal items. She's now able to get the personal items that she needed on a monthly basis. A caregiver, same story. This simplified her life because she didn't have to worry about getting the person she's giving care to and from the doctor. All the additional benefits helped tremendously. She was able to get the personal care items that she needed. And one of the big important factors for this person was they didn't have to spend money anymore on cab rides or the personal items items at the drugstore. It freed up that amount of money. So there was actually some discretionary money for her person. And it was just very liberating for them on all of them. And this plan it's very powerful. It does a lot of things, well, and it helps not only the individual, but the caregivers as well. And here's just some more things that we've heard from our clients. One lady needs to take melatonin to help her sleep, and her doctor didn't want to prescribe sleeping pills, and those melatonin can be a little expensive. So she was able to get melatonin through the personal items. Another one said, my caregiver couldn't get me to all of my doctor's appointments, and she lived by herself and she had no other way to get to the doctor's appointments. Well, now she does. The hearing aids there in the middle, she was able to replace her hearing aids and get new ones that fit and worked a lot better. So all of the parts of this program, whether it's going to the doctor, the personal benefits, the transportation, they're just incredibly essential components to help people live a daily life, and they can stay in their home. And that's one of the things that we really, really touches us, is that it helps people live, improves their quality of life, really. And we're very honored to be able to offer that to people. Here's just a chart about if you take advantage of all of the features and the benefits in these plans. I mean, you can see there on the far right, it saves a lot of money. And every dollar, we know every dollar that everybody has available matters. And this plan brings with it a lot of cost saving. And it's money that you now have available to spend on other things, or just have some money in the bank and not have to worry about as much money. And here again, here's another caregiver story. This lady, we met, her brother, I believe, was in an accident. He had a heart attack. That's right. He had a heart attack and had a tremendous amount of issues after the heart attack, and was on this plan for 9 years. And I believe he was in ICU or CCU for 9 days before he passed away. And the bill was astronomical, and the dual special needs plan paid it all. And there was no co-pays, nothing. And Carol was very thankful for that, and is a big proponent of this plan because of that. Okay, so there's a lot to this plan, and we've shown you some of it, but here's really, here's what you need to do. You need to have both of these cards, the Medicare card, the red, white, and blue, and then the Medicaid card, the green one there. And we check your eligibility. We're here to help you with anything, really, but check your eligibility to see if you can enroll, and then help you process the enrollment, and then manage that process as well. All of our conversations with you and the insurance companies are private. Privacy is the utmost important to us, and we do everything to comply with the Center for Medicare and Medicaid, CMS, about document retention and security of documents. And that's how you get a hold of me. My mobile number there and the email. And we can certainly sit down with you and provide more information to you, and show you how the program works again, and all of the different benefits.
And during this time where we're all not meeting face to face, so we do spend time with people on Zoom, and we can certainly do that. And we can also FaceTime. We do a lot of ways to make sure we're keeping everybody safe. So, and then with some folks that they still want to meet face to face, and we do that. And we have a vast array of collection of cool masks that we wear when we meet face to face with people.
Okay, anybody have any questions?
So before questions, Kathy, if you could come off mute, and why don't, if you're comfortable, why don't you talk a little bit about some of the things that your son and daughter have been able to utilize the program for?
That's great. So one of the big benefits, I think, for them is they have a lot of kind of over-the-counter things that they need, you know, over-the-counter medications and a lot of things like that. So having that extra $300 a quarter has made a huge, huge difference for them, for us, because we were paying those things off out through the quarter. And, you know, one of the things that we were able to get during this time was disposable masks and gloves. So they were things that were really useful, even though, so some of the benefits we can't use right now because we're home, but because there were several things on there that were really helpful for us. You know, I think if you're interested in it, I think the things that they are really helpful and talk with them about is, you know, the questions you need to ask are, you know, if you have doctors that you like or specialists that you need to see, you just need to ask them, find out which plan has that specialist on it, and find out, you know, are they on the plan? And because there's several plans to choose from, you can ask those things. The other thing that you would really want to look at closely is if you take medications or specialized medications that maybe aren't usual, you'll want to make sure that those medications are covered. My son takes a medication that's very costly, and I was really worried about that. So I wanted to be that. I made sure they looked and said, "Is that medication covered?" And it was. So that was a really big help to us going forward. And you know, it's great not to have to mess with paperwork and the billing with doctors and such. So, yeah.
Thanks, Kathy. And I will say this, and Kathy brought up a really good point, is that if somebody decided they want to enroll, one of the things that we absolutely do as a course of business is to work through and ask who the doctors, every single doctor is, because we have access to all the plans and we know who's in network and such. And so we do take that step, absolutely. And to Kathy's point, we check all the medications and such too. So when we come back to you, you will have a nice, clear peace of mind that everything is covered and that you'll have a seamless transition over to the dual plan. So we spent a little bit of time with Kathy to make sure.
I was going to be sure.
And we love that. We love the due diligence because that means on the back end, things are just humming quite along quite nicely. So absolutely. So thank you.
Also, I was just going to share one other thing. I think one other thing is if you're on Medicaid, the dental plan is often exceedingly limited and it's difficult to find providers. And I think that because there's a larger benefit on this, you may find it easier to find a dental provider that will take the plan. Now, I haven't had the opportunity because we've been in quarantine to try that out yet, but it's very challenging to find a dental provider that takes straight Medicaid, and it doesn't provide a lot.
Yeah, you bring up a good point, Kathy, because there is one of the plans that does use their broad network. They use that is also available for the Medicare, the over 65 market. And so that way it opens up a lot of dentists in the area that would typically maybe not be there. So that is an excellent point to bring up. And because this is a Medicare Advantage plan, then there's some things that you can take advantage of that are traditionally reserved for the over 65 market that would be available to you for this particular plan as well. Yeah. So why don't we open it up? Thanks, Kathy, so much.
Sure.
Lizzie, I think I just saw you come off mute. So did you have a question?
Yes, under this Washington State COVID-19 vaccination plan, it shows clearly here that those people in homeless shelters or group homes with individuals with disabilities, including serious mental illness, developmental and intellectual disabilities, and physical disabilities are in recovery, and staff who work in such settings are in phase 2, the second phase for the COVID-19 vaccine. And so my question is, do Medicare and Medicaid cover the COVID-19 vaccine?
Well, right now the plan is that they will cover that. We haven't been given the final instructions on that yet, but right now they're saying they're going to cover it. I think they're waiting until the vaccine is available before they put that determination out, but everything that we've been told is that they will cover it.
Yes, because it's right here that we Special Olympics athletes and those who work with us and our families are under phase 2, the second phase of the plan.
I see.
Yeah.
Okay.
That was a
So-
great question, Lizzie.
Yeah,
Yeah.
so
Thank
one
you.
of the things that as we kind of, keep continuing this COVID journey that we're all on, I think you'll see that things will ebb and flow to support that. So like Pat said, since the vaccine is not out yet, typically we don't hear of things till it's an absolute. So to Pat's point, I think you will find that you will find coverage for that when there is an absolute, there is a vaccine and they can make an absolute statement on that for that. Good question, Lizzie. You're on it.
Thank you.
Any other questions? Comments?
I'm wondering if you can clarify the process that someone would go through just a little bit more. So their first step would be to reach out to you and have a consultation to confirm their eligibility.
Yeah, so what we would do is if you wanted to find out about your eligibility, you would reach out to us and let's kind of go to the front again. At the very beginning here, whoopsie. Let me go back to that. And I don't
So
have
while
my-
Norma's doing that, at the very beginning, I mentioned the 2 cards on that front page, the red, white, and blue card, and then the green card. So we are required by Medicare and Medicaid to check eligibility, meaning we have to find out if you're eligible for the plan. So we get your numbers, your Medicare number and your Medicaid number, and we call one of the insurance companies have access to that information through Medicare. And we check and make sure that you're eligible for the plan. Once we determine eligibility, then we talk about the plans and which plan is the appropriate one for every individual. We're going to check to make sure the doctors are in the networks, that the medications are covered, and then from there we talk about enrolling somebody. The application is pretty simple. It doesn't take very long to complete, and we can get together with, as Norma mentioned, we can get together with you, or we can do that online now, and we'll complete that. And then we monitor the approval process, which usually takes 3 to 5 days.
And I think that's what Pat just said, is that everything now we are online, so it's all done electronically. And so it's a pretty seamless process. I think, Kathy, we did yours electronically earlier this year. No, I think we did. I'm not quite sure, but it's very seamless. All the carriers have an online system now, so it works out pretty well. And so we don't have to meet face to face, because I know everyone is sensitive to that these days. So that is definitely the process. And then once you decide and you want to be on the plan and it's approved, every person starts the following month. So an example, say today is October 26th, and you decide tomorrow that you would like for us to check your eligibility, you want to enroll. Typically, you would start the following month, so November 1st. However, because if you watch TV lately, you'll notice that there's a ton of commercials around Medicare, and this time period between October and December 7th is called annual enrollment period. And so anybody who enrolls in a dual plan between now and December 7th, their eligibility will start January 1st. But typically, outside of this election period, you would start the following month that you enrolled. And the other thing about the dual plan is that every year your plan resets at January 1st. So you'll start on January 1st with all new over-the-counter items benefits. You'll start with new transportation benefits. You'll start with new dental benefits. You'll start with new vision benefits. Everything will reset at January 1st. And then again, then on December 31st at 11:59, right at midnight, then it resets again for 2022. So it's an automatic every year renewal unless you decide that you would like to not be on the program.
That's great. You're right. It seems like there, so many more people should be taking advantage of it. Do you see yourselves as being, is the bigger part in educating people about it?
Yeah, that's a great question. And as you might have remembered in our bio, we talked about our dachshund who really runs the show, and you can kind of see he has decided he wants to.
He joined the meeting.
He wants.
Oop, wait, you're accidentally on mute. Maybe he bumped your mute button.
Oh, yeah, he did. See, he tries to do things. So he's 15 and a half years old and he thinks he's in charge of everything. So yeah, we do see, this is a great question, Leah. We do see ourselves as educating folks because as Pat said at the beginning of the conversation, there's 12 million people in the United States that are eligible. About 1.2 are enrolled, and in our area, about 28% of folks. And 28% sounds like probably an okay number, but if you really think about it, what the benefits and such are for this program and what it can do from a financial aspect, it really is more of a lower number. And I try not to be a negative glass half full person, but I think that the more that we can educate people to understand what is out there for them. And I always say, yes is a great answer. No is an equally powerful message, but saying, I don't know, then that leaves you someplace where you don't like to be. So information and knowledge is power. And that's part of why we talk to various groups around, is to educate them on what's available, because it's okay to say no, but you'll be saying no from a position of information versus a position of not knowing. And so that's why I think education is so important for everybody, is just to know what's out there and what's available to them.
To give you an idea, in the Puget Sound area, in Snohomish, King, Pierce, Thurston, and Kitsap County, there are about 170,000 people eligible for this plan. There's only about 35,000 enrolled. So it is truly an education process in getting the message out. And the biggest response we get is really two things. One, I had never heard of the plan, or they're kind of blown away and they're a little skeptical at first because the benefits are so good and the costs are so low.
Does anyone else have other questions? I think we have a small group, which I think gives us a great chance to be able to talk to everyone pretty individually here if we do have questions that are coming up.
I have a question. And I know Norma and Pat, in our previous conversations, we talked about, we know that a lot of people with intellectual disabilities also get services from DSHS and other state services. And I'm wondering, how does that accompany, overlap with the dual special needs plan?
Oh, that's a great question, Dallas. So you're absolutely right. There are a lot of folks who have DDA waivers and various things and this plan does not take those away at all. So again, it stays in its own, for your healthcare, it stays right there with you. And then all your services and things that you have with other organizations stay completely intact. So we talked a little bit about it in one of the slides where he said it doesn't cancel anything from Medicaid or Medicare. It does not cancel one thing. And I think that's really important to know, is that you're not losing anything when you decide that you want to become enrolled in a dual plan. You're actually more than likely gaining more because you're going to be gaining more benefits for that, but you will not lose any of your current benefits or waivers and such that you currently have.
Awesome. Thank you.
Sure.
Are there any other questions?
Do you foresee there being any problems with funding as more people are joining the program?
No, we are constantly reassured from the insurance companies that this last budget act that they passed a few years ago made the funding mechanism permanent. Now, with that said, it's still up to Congress to fund the program, but right now they're comfortable saying that the funding is permanent, and we're hopeful that it stays that way. And as you've seen, there's a lot of people that can still take advantage of the plan. It's available to a lot of people. We're very hopeful that it is now permanently funded and not going to be a problem.
And to add on to what Pat said, it's permanently funded underneath Medicare. So that is something that, you know, in 2000, like Pat said, in 2018, under the Budget Act, it became, you know, that act. So in terms of the carriers that offer the plan, they're very bullish on it. You know, benefits have not decreased. In fact, they have been steadily increasing on the plan. So we still remain very, very positive on the plan, that it is going to be a permanent fixture of Medicare, and we've received no guidance to indicate otherwise, as Pat said.
That's great. That's really awesome. Do we have any other questions? And let's see, there's a question from Donna. She asked, is there an age limit to start the plan?
Oh, that's a really good question, Donna. And the answer is no. But in order, what we typically see is most of the individuals are over 18 on it, and it can go all the way, it can carry you all the way through. So we typically see over 18-year-olds. In the United States, I believe the statistic is about 200,000 individuals under the age of 18 are on the plan. And then the vast majority, then that 1.2 million is over 18. But the key thing, Donna, is those two cards in the upper right-hand corner, the Medicaid card and card. Those are really the entry gate into the dual plan. Age not a factor.
And I'm sorry, I think you already said this, but you said that it carries over every year, regardless. You don't need to, as long as you're still eligible.
Right. So yes, if you're still eligible, it automatically renews every January. So if you want to stay on the plan, you don't have to do anything. They'll just send you a new insurance card for that year, and you're good to go. So it automatically renews every year.
And I will say this, is that it is super important to always make sure you continuously fill out your paperwork that you get for your benefits for Medicaid and such, because that is the, you know, every year they're utilizing the databases for Medicaid, Medicare. So if you do not fill out the required paperwork that you have to fill out, then that could be an issue. So we always say, please continue to always fill out your paperwork so you always maintain all the benefits that you're entitled to.
Looks like we have one more question that came into the chat. How do you qualify for the Medicare card if you are under 65?
So the Medicare card it's based upon disability. You have to have a qualifying disability for at least 24 months. In general, the disability or medical condition that leads to a disability has to be permanent with a lifelong diagnosis. Once you if you fall into that category, you need to apply through Social Security for the Medicare benefit. And it's called SSDI, Social Security Disability Income. So you would need to qualify or apply through Social Security for that benefit, and that will give you the red, white, and blue card if you're under 65.
Can I add something there?
Please, Kathy.
Yeah, so you have to have a disability, but you also have to either have a work record. So you've had to have worked for X amount of time, or you have a parent that is either retired, deceased, or disabled. Yeah.
Thank you.
And as far as resources go, because it'd be great. We'll send out you know, the links to the recording, your PowerPoint, and that sort of thing.
Okay.
So I'm wondering, that's something that we can include as well. Some links directly through SSI and sort of where some of those, how you learn more about.
You know, we do have in the
Okay.
deck, and I'll call those out to you.
Oh, great.
Resources on the very last slide. So we'll talk offline and I'll show you where those are.
Perfect.
So many great questions. I like
Yes.
having a smaller group sometimes. This is great. Well, if you have any other questions, just put them in the chat or feel free and unmute yourself. We've got about a little over 10 minutes left. So Norma, Kathy, Pat, do you have anything else to add before we switch gears to just some other last minute things?
You know, I think we're probably pretty good, but one of the things that Pat said at the very beginning of the conversation, we are so looking forward to be back and seeing everybody face to face at basketball and golf and swimming and all sorts of things. It is such a joy to watch you compete, and we look forward to seeing you back out on your field of sport. It'd be awesome. Awesome.
Well, thank you all so much for being our amazing panelists for tonight. I learned a lot, and I feel like I need to hear your presentation like 10 times to really, because every time I like see something new, I'm like, oh man, yeah, I forgot about that from last time. So thank you so much. And Kathy, thank you for sharing your experience. And yeah, this has been a fabulous night. Before we take off, I'm just gonna share a few last minute resources. So we want to stay engaged with everyone after this call. I know Andrew is definitely part of our SOA Health and Fitness Challenges page. But if you are a family member, caregiver, supporter of a Special Olympics athlete, we encourage you to join the Sideline Supporters group. That is where we share a lot of information like these family health forums. And Leah also shares a ton of resources from the ARC and other partners that we have statewide that we just want to get the word out to our participants and their families. And I also want to share that our next forum will be on January 25th. We're taking a little break during the holiday, but we'll be back in the new year. And we will be talking also about insurance, but with a different organization. So we hope that you can join us for that as well. And last but not least, here's our contact information.